Hello, and welcome to the Brain-Based Learning Strategies for the NDT Educators presentation. My name is Michelle Williams, and I've been in the neurodiagnostic field for about 10 years. I started my career as a trainee participating in an informal on-the-job training program, and throughout the years transitioned to a clinical coordinator and an instructor. Currently, I am a graduate student at Wright State University, majoring in the Master's of Education in Instructional Design for the Digital Learner Program. So, from my experience as a trainee, as an EEG technologist, and as an instructor, I hope this presentation will provide a new insight to our educational delivery in our career field. Most of us have a misconception about how we learn, and as educators in the neurodiagnostic field, we can improve our practices using neuro-based strategies in our training programs. Neuroscience is the foundation of our profession, and neurocognition and psychology can supplement our knowledge when it comes to learning how our brains process and also retain information in our field. Hopefully, the information given in this presentation will allow you to improve your training design and explain to students the importance of science-based learning strategies. The learning objectives for this presentation is to identify 3 ineffective learning practices, as well as identify 3 science-based and effective strategies. These 2 objectives will lead to potentially forming ways to implement new strategies within your own neurodiagnostic training program. In a neurodiagnostic curriculum program, whether it is a formal or informal training program, or even an online-based program, a spectrum of information is expected to be learned as a student. So this includes neuroanatomy, electrical fundamentals, and equipment troubleshooting, EEG patterns and correlations, just to name a few. According to the Commission of Accreditation for Allied Health Programs, the skills needed to be a neurodiagnostic technologist include individual initiative, reasoning skills, and also sound judgment. These skills demand more effective learning skills for students to process and utilize what they have learned in the classroom and apply it to the field. As an educator, class design is not solely to provide information alone, but to also create a learning environment for knowledge retention and to provide effective learning strategies for students. Most of these programs do include clinicals, yet many of the ineffective strategies are being used to retain all of the educational material that is provided. This can be used by utilizing some of these science-based strategies that we are about to discuss in this presentation. The way our brain receives information and breaks it down has been misunderstood for several years, and many of us don't even know that we're using ineffective ways of learning. Mass studying is one of the most common strategies most people used in the past, and they may even think it works because when you cram for a test, a lot of times you can get a good grade afterwards. However, a couple of days or weeks later, most of the information learned is forgotten. Studies have shown that this habit can be misinterpreted as successful with high test scores immediately following mass study. One research study had even shown that within 2 days, half of the information was forgotten from the initial test. Space study, where information is broken down into smaller space study sessions, are shown to be more effective rather than trying to learn a massive amount of information at one time. Rereading is another popular strategy used by students that is very time-consuming and also ineffective. Many learners think if they keep rereading material over and over in a close time frame, it might become imprinted into their memory. In a study that was featured in the Contemporary Educational Psychology Journal in 2008, revealed limited benefits to rereading information in a short period of time. Rereading one time versus multiple times close together yield no significant improvement in learning. Both mass study and also rereading can create an illusion of knowing as well as many other factors. Students can reread text and have what is called a fluency illusion, where they know the material and they underestimate the complexity of the subject. For example, a student could have memorized the entire section for seizure semiology, but unable to detect a patient having a complex partial seizure in a clinic. Another concept relating to the illusion of learning is called the Dunning-Kruger effect, derived from a study by two psychologists by the name of David Dunning and Justin Kruger. They conducted studies that showed that incompetent people could overestimate their performance, use poor judgment, and be totally oblivious to the need of improvement in how things should be done. This can be improved by providing measurable self-judgment tools and also providing corrective feedback with students. Now that I've discussed the challenges with many of the common issues in learning, I'm now going to go over what neuroscience has discovered about how we can learn better and more efficiently. Emerging research has supported the phenomenon referred to as neuroplasticity, which is the ability for our brain to strengthen and redistribute our neural pathways for knowledge and memory. The hippocampus, which most of us in our field are familiar with relating to temporal lobe epilepsy, also plays a crucial role in neurogenesis, which is where we can strengthen our learning and memory pathways. This is where the connection to neuroscience and the way we learn meet. Neuroscience is still a reasonably new idea that is being studied, but research has already shown that specific strategies where information is reintroduced through memory retrieval and space studying can create long-term preservation. These neural pathways can be strengthened by incorporating science-based strategies to enhance our long-term memory retrieval consistently. This, in the end, will help our students be able to retain and retrieve information to use on a day-to-day basis. Educators can explain to students the reason behind new learning strategies and encourage them to adapt effortful learning. Psychologists Elizabeth and Robert Bajorek call this desirable difficulty. That's when more effort and more difficulty in learning is used to build stronger, more durable learning connections. I will cover 3 of these strategies, which are retrieval practices, elaboration, and also interleaving. These strategies can be used beyond the training platform, with information being introduced frequently to challenge the learner and to encourage them to remember information. This seems challenging for learners, but this strategy can form durable, long-term memory pathways that can go beyond the training program and used in the day-to-day practices. Retrieval practice and also space studying that was mentioned earlier can allow students to learn smaller portions of information and then reintroduce material by enabling the brain to regenerate that memory of what was learned. This can be presented in several different ways in a training session. It can be a quiz game that can be conducted in class, self-quizzing among the student, or actually flashcards are another good option for retrieval practices. Online practice resources are another option for on-demand, small frequent quizzing that can be used to help the facility if you do not have a structured class time versus just having the trainee review material. In a study that was completed among attendees at the American Academy of Neurology conferences, Participants retained almost twice as much information by simply doing small quizzes throughout the conference compared to those who had just reviewed or didn't do anything at all. Retrieval practices can also help prevent illusions of knowing by providing students a measurable tool that can show mastery, progress, and even areas that can be improved. Interleaved practice is a less popular strategy among students and for some educators because it might seem to be a little confusing, but it is an effective strategy, especially in healthcare. In one study, medical students were evaluated learning ECG diagnoses using two different instructional methods. The group that was taught using mixed categories had a higher diagnosis accuracy compared to the group that had a more structured setting. Interleaving will prepare your learners for real-world settings and can promote discrimination between which information learned can be applied and deciphered for a problem, and then also choose an appropriate solution. This can be introduced in your training class design by intermixing sections to overlap and interchange between different areas of learning. This can be particularly effective in training for learners that have various roles and responsibilities. For example, teaching two modalities interchangeably can provide a connected knowledge with two different test processes. Elaboration is another practice that encourages memory retrieval among students and can demonstrate mastery in areas by finding multiple layers and meanings behind new material. In one study evaluating 231 students with several different learning practices with students in basic medical science, elaboration scored as the most useful tool. This can be introduced in training by creating questions to extend knowledge retrieval and even to connect new content to past sections. This can be done in clinicals with patient cases and also in the class setting. Students can be given the opportunity to explain the why and the how questions to subjects and also allow students to define in their own words material and how it relates to patient scenarios. One example would be to create summary sheets while discussing different patients and include different information such as seizure types, clinical and EEG correlate, location of discharges, pattern descriptor terms that can be used, and things of that nature. This can also show mastery of sections plus retrieve and use previous information. This concludes the presentation. I am hoping that you've learned something new that will motivate you to implement some of these new strategies within your neurodiagnostic program. Thank you.